Hello, my name is Kalaya Bunton. I am a student at the University of South Alabama, and today I will be doing my medicine administration checkoff skill. Here's my card. And I will be administering Novolin R regular insulin U100. I will pan the room. Do not have any notes. I would state this would be a no interruption zone, meaning that nobody would come in and out of the room. I would not talk to any colleagues unless I have any changes in medicine administration, and I would not take any phone calls. Medicine administration record, my AMR, my patient care order form. I will state the 7 rights. Indications would be that the insulin is used to lower blood glucose. The right patient is Jaguar J. Jones. Correct medication is Novolin R regular insulin U100. Novolin R regular insulin U100. Dose 10 units. Route subcutaneously. Time 30 minutes before meals. And the documentation is all right. And the allergies, they have penicillin. Penicillin. And then I will do hand hygiene before I touch my vials. I have my vials. Got Novolin R regular insulin U100, expiration date 12/1/2025. Perfect. Nice. And I would look at my AMR. Look, Novolin R regular insulin. Novolin R regular insulin U100. 10 units is the dose. Subcutaneously is a route. 30 minutes is time for meals. Jaguar Jones is the patient. Used for decreased blood glucose levels. This is my syringe I'll be using. It's my insulin syringe. It already has a pre-attached needle, which makes it simple. And now I'll take my alcohol pad and wipe the top of my vial. Okay, I will open my syringe sterility. Now I will pull back 10 units of air. I'll take off the cap. Put it in my patient. Upside down. Slowly put in air. Take it out. Slowly, making sure it's at the 10 unit mark. Bubbles. I have a slight bubble. Let's redo it. I had a slight bubble, so I'm just gonna redo it. Okay. I will scoop my needle into my cap, but I would only do that in a sterile field, medical sterile field, and I would never recap a used needle. Units. Now I have a nurse check on my calculations, my medication, and my dose, making sure everything is okay. I'll create my label for my medication, my syringe. I will put the patient's name. It's Jaguar J. Jones. The unit. Or the doses, 10 units, and then I will do the medication. Okay, I have everything on my, the patient's name, the medication, and the dose, and I'll put that on my syringe. I would head to my patient's room, my syringe, my vial, and my AMR, knock on the door, and I would enter when prompted. I would do hand hygiene, perform hand hygiene. I will assess the patient in 2 identifiers. Jaguar J. Jones. Jaguar J. Jones. Date of birth 8/25/1963. Date of birth 8/25/1963. Allergies with penicillin. Ask for any other allergies. Do you have any other allergies? If not, then I will do a administrative assessment depending on the type of medicine. Some people don't need it. And then I will do my last check with my syringe and my vial on my AMR. Novolin R regular insulin U100, Novolin R regular insulin U100, 10 units subcutaneously. It's a route, 30 minutes for meals is the time. And then Jaguar J. Jones, this person, Jaguar J. Jones, everything looks good. Okay. Hello, Mr. Jones. My name is Kalaya Bunton, and I will be giving your insulin today. And it is 30 minutes before your meal, so it's the perfect time to administer your medicine. And I will give you your medicine subcutaneously, and I will tell you the injection spots in a second. So now I'm gonna put up their bed to a working height, waist level, put down their side rails, put on my clean gloves, don my goggles, and I will put the injection site on the dorsal lateral of the arm, so it'll be 3 fingers over the olecranon or the elbow, 3 fingers, and then 3 fingers down from the brachial, no, it's the deltoid insertion, 3 fingers down from the deltoid insertion, excuse me. And then I will go in this area, 1 inch pinch for 45 degrees, 2 inch pinch if you can for 90 degrees, and I will put it in this area. But for Mr. Jones, I would take off the I will expose the area. I will give you your skin, which is your back of your arm right here, and I will assess your skin for the skin integrity. See everything's okay, bruising, redness, no, everything looks good. And now I'm going to use an alcohol pad to clean your arm. Alcohol pad to clean your arm. I will grab a new one, circular motion. I do not have any new ones, so but I will use a new one. And then I'm going to leave it to use for post injection. And then now I will squeeze your arm, back of your arm. Sorry. I would open, and then I would put it in, quickly insert, slowly, let go, dump in my sharps container, put slight pressure on the site. I would look for any allergic reactions to the skin, and I will clean up after myself. I will take off my glove, put off the glove, skin to skin, towards the trash can, and I will put my patient into a comfortable position. Let me wash my hands first, and I will put my patient in a comfortable position, put their side rails up, lower them all the way down. I will document their the patient's response to the medication. Depending on certain responses, you would have to go back and assess them every like 30 minutes after you administer it. That depends on certain medication. And that ends my medicine administration check off. Thank you.